Aesthetic dentistry is dentistry that is created to match the particular needs and requirements of a patient. It's not just having white teeth, it's not just having a particular curvature, it's having a morphology, shape, shade, characterization to the teeth that are individually matched to the requirements of the patient.
There are very definitive aesthetic parameters that can be used to determine where teeth belong in a patient's smile and when a patient's talking. There's a certain amount of tooth that should be displayed when patients are talking, and there's a certain amount of tooth that should be displayed when they're smiling, and there's all different aberrations. There's all different things that affect that. Lip length, lip mobility when we smile, the shape of the face. And what Woody and I have developed is a protocol using photography and using a template that we have actually developed in PowerPoint. We can take tooth shapes and start with this analysis of the patient's face, their midline, their lip mobility, determine where the teeth really belong. And sometimes when patients have a lot of problems with their teeth don't need to be moved back to where they were in youth. They need to be moved back to where they belonged in the first place.
So part of the process that's essential here is to have a methodology to identify these issues that are aesthetic and individually aesthetic for each and every patient. The method that we have allows the patient and the doctor to sit down and go through and discover these items in a stepwise fashion so that the patient can understand, and indeed we have the ability to visualize what the recommended changes would be for that patient so that that becomes a blueprint for us to follow as we create that individual aesthetic for the patient.
And one of the things we always hear when we sit down and do this for patients, and we sit down in our little consultation room with the pictures and our little templates and show them these things, more times than not, patients will ask us, why hasn't anybody ever shown me this before? And frankly, it's something that we've developed, and it's just not out in the market that people use it a lot.
We do teach it to other dentists because it's a skill that many dentists want to acquire, and so we're happy to share it with others because it is a very powerful tool to help the patient understand and visualize what the recommended aesthetic changes would be.